most important parts of diabetes management is home blood sugar monitoring. Most people with diabetes have a home blood sugar meter that they use to read the level of glucose or sugar in their blood. This information is very important to help you and your healthcare provider make decisions about your treatment, including medications, diet, and exercise. In this video, you will learn what a blood sugar meter is, how it works, the best way to get a blood sugar reading at home, safe storage and disposal of the lancet needles, and use test strips. Now, let's begin. There are several parts and steps involved in checking your blood sugar. To check your blood sugar, you will need the following: the blood sugar meter, your lancing device with needles, your test strips, a cotton or tissue, a logbook or another way to track your blood sugar information such as an app on your phone, a sharps container, and optionally you can use an alcohol swab. Next, insert a lancet or needle into the lancing device. First, remove the cap from the lancing device. Then take a new needle and insert it. Then twist the protective cap covering the needle until it comes loose. Remember, don't pull on it until it comes loose. Then replace the cap on the lancing device. On most lancet devices, you can decide how deep the needle will poke the finger by adjusting the number on a dial. Higher numbers are deeper, lower numbers are shallower. Take into account your skin thickness. A level 1 may not work on most adults. If you have very tough skin or any calluses, you will likely need a deeper setting. To start, most patients use a level 2.5 or 3. Insert the test strip into the blood glucose meter. Remember that each meter has its own test strips that must be used. When the test strip is inserted correctly, the meter will turn on. Now we need to get a drop of blood. To make this easier and more comfortable, there are a few tips to live by. Only use the sides of the fingers. Avoid the tips of the fingers or the pad of the fingers. Rotate where you poke your finger, and don't always use the same finger twice, or you can develop scar tissue. Use different fingers and different sides of the fingers. Next, we need to prepare the lancet to poke the finger. Slide back on the lever if you have one. Then put the end of the lancet to your finger. To make sure you don't pull your hand away, it might help to have your finger flat on a sturdy surface like a table. Now go ahead and push the button to poke the finger. Once you have a drop of blood, wipe it away with a Kleenex or the cotton swab. Then use the second drop of blood to check your blood sugar. Apply it to the strip. There will be a small line or space at the end of the test strip where you will place the blood. When you touch the blood to the strip, it ought to suck it up. Dispose of the used lancet and test strip into a sharps container. Many needles will come with a cap that you can apply to the end that you had removed earlier. This will keep anyone from poking their finger accidentally. As you can see, the blood sugar meter or glucometer displays your blood sugar number. Most meters have meter memory, which means they will store your blood sugar readings for up to 3 months. Or you can record your blood sugar in a logbook or in an app on your phone. Store test strips in a cool, dry place. They do not need to be stored in the refrigerator, and you should avoid storing them in a moist or very hot place. Make sure to check the expiration date on your strips before using them. There are several times during the day that you can check your blood sugar, and different times may give you different information. Your healthcare provider will discuss with you the appropriate times and frequency to check your blood sugar readings based on your treatment regimen. Most people using insulin will need to check about 3 to 4 times per day, often before meals and at bedtime. People with diabetes who are on oral medications alone may only need to check once per day. However, it is important to check your blood sugar before you drive, and sometimes before bed, especially if you are more prone to having hypoglycemic or low blood sugar levels. Most people that check only 1 time per day will need to check their fasting number first thing in the morning before they eat or take medications. There are many different types of blood glucose meters with different features and different sizes. Check with your healthcare provider to find out which meter is best for you. You cannot reuse test strips or the needle in your lancet. Please dispose after each use. Do not use expired test strips. They may not give you an accurate reading. Do not throw lancets in the trash. Use a sharps container. Make sure that the time and date in your meter is correct. Don't forget to change that at daylight savings time. Bring your meter with you to each visit with your diabetes doctor, nurse, or dietitian. You have now learned how to use a blood glucose meter to monitor your blood sugar at home. When used routinely and properly, it can be a vital tool for you and your diabetes provider to manage your blood sugars. Talk to your provider about what blood sugar targets are, how frequently you should check your blood sugar, and what times you should check during the day. Bring your blood glucose meter with you to every visit, as your providers can learn more about how your diabetes is being managed and make recommendations to improve your control. Remember, the numbers are knowledge, and knowledge is power to managing diabetes.